we'll go to Pat Healey with the Laker next. Go ahead, Pat.
Hi, this question is for Dr. Strang. Last night in an interview, Dr. Tam said it was time to get rid of the single layered cloth mask and maybe even the 3-ply surgical type mask, with only an N95 type mask being a better fit for people's faces. Will the province be making any changes to what masks Nova Scotians should be wearing?
So we were aware of some changing recommendations coming from the federal government. We weren't aware that they were going publicly. I have people on my team on a national call right now, and that's one of the topics on the agenda. So we'll understand what the federal government is saying. My understanding is that advice was really directed towards both healthcare workers and people who are visiting into healthcare facilities. But we'll take the time to understand completely what any new direction from the federal government and what that then may mean for Nova Scotia. But this is new, evolving information.
Do you have a follow-up question?
Yes, I do. Premier Houston, and maybe Dr. Strang can weigh in. How soon will educators and parents, guardians of students know if they will be returning to in-person learning after the extended break on January 6th, or if they will be pivoting to online learning? What will the epidemiology need to indicate to get kids back in school on January 6th?
Thank you, Pat. Of course, people remember that we pushed the return of school back by a couple of days. That's already happened, and of course, we're always mindful. I see what's happening with some universities that are going to online. So we'd ask our educators and people working in education to just think about what's possible if we have to go there. But the answer to your question of how soon is as soon as we can, and as soon as that decision is made. So we need to see how we put restrictions in on Friday. We've decided to kind of strengthen those restrictions at this stage. It's unusual to strengthen restrictions so quickly, but we're in unusual times, and we'll continue to monitor. And if we need to make that call, we'll make it as soon as we can. So I just ask people to bear with us, and we are optimistic that Nova Scotians will respond as they always have. We'll get these case numbers coming down because we're limiting contacts and we're slowing down. And then we'll continue to watch where we go from there. But thank you for asking that question, Pat. I know it's on the minds of a lot of families.